Why is cancer of the lungs very dangerous, and why do we need to talk about it? Number one, it is very difficult to screen cancer of the lungs. Now you see, this cancer spreads through the lymph nodes, the lymph and the lymphatic system and the lymph nodes. If you have tonsillitis, when you do a palpitation of this, the tonsils, you will feel some form of pain, right? But nodes that actually this cancer affects most are behind the sternum. The sternum is this bone here. See this bone that rolls from the neck all the way down here? The one that actually supports the ribs. The glands that are behind that sternum are the ones that are affected with this cancer. Because those glands are hidden behind the sternum. You cannot do an examination of lymph nodes behind the sternum. That is one. Number two, there's no much pain because by the time you're getting here, you already have another type of cancer, possibly. You just didn't know. So you've treated other types of cancer. You've tried to treat colorectal cancer. You've tried to treat breast cancer. You've chopped off your breasts. And then later on, you're told, you know what? Kumbe, the breast cancer had spread to the lungs. So by the time you're getting this diagnosis, it's already too late. So it's difficult to diagnose it adequately and to screen for it. Number two, many patients are asymptomatic. There are no symptoms. They just experience symptoms in other organs. For example, when cancer has spread into the heart or into the brain, they start experiencing different symptoms. So when they get the brain tumors, possibly it's actually a spread from the lungs. When they get the liver cancer, possibly it's straight from the lungs. So by the time they are getting a diagnosis, they were getting a diagnosis of an other organ, cancer that has spread from this organ from these lungs. So you see how difficult it is. Ningumu. Before we screen ujue ini lungs is involved, there's a lot of things. You've treated TB when this guy was coughing, it subsided, came back. You've treated pneumonia, subsided, came back. You've went for the bronchitis, nothing is coming out. You've done a chest x-ray, you see nodules. Now you can now say, oh, you know what? Now this is a problem here. Maybe we could do biopsies. But I'll take you through diagnosis and you'll see how broad it is. That's the reason why it's actually hectic to actually screen for it. So you've even treated asthma. And how many of our people are constantly taking beta-2 agonists, salbutamol? You call it Ventolin. There are people who are constantly taking Ventolin and they are busy knowing that they have asthma. There are people who are always constantly on prednisolone, the steroids. So they take the steroid, their lungs open up a little bit, the inflammation is gone, they believe their asthma is gone, and then next week again they are on another steroid. There are people who constantly are on an inhaler that has the steroid plus salbutamol. Just the same way we said, most people who keep on treating gastritis and the ulcers and H. pylori end up coming out with the pancreatic cancer without even knowing. This is the same case here. You're busy treating asthma, you're busy treating bronchitis, you're busy treating pneumonia, you're busy treating TB, yet the real animal is just building itself underwater. As you suppress the symptoms of this animal, thinking that is another disease, the animal is busy building a home just from inside. And by the time you get the true diagnosis, it's already spread into other organs. Yes, Montelukast. You're taking this drug, and some of you even the cetrizines. People know that, you know what, when I have this difficulty in breathing, I'll go take Montelukast. I'll go take Nedocromil. I'll use my inhaler. So you never take it serious. And even if you go to the hospitals, the clinicians are following guidelines. So they'll check the symptoms. They will send you to the lab, maybe do a sputum test. They rule out, the gene expert, they rule out TB. They put you on some steroids and antibiotics because they're thinking it's an infection. You go take those antibiotics for 10 days or 5 days, thereabout, you get better a little bit. After 2 weeks, you're back. Sometimes it goes for about a month and then you come back to hospital. Same diagnosis, same medication. And now you even get used to the medication, and the next time you're going to the hospital, you don't even need them to actually diagnose you of anything. You simply go straight to the pharmacy and buy Augmentin. And buy prednisolone. You know, mimi nikimeza PDL, you call it PDL. Mimi nikimeza Augmentin na PDL, kifua yangu inakuwa sawa. Mimi nikipata ceftriaxone injection, niko sawa. Hii pneumonia yangu inataka tu injection ya ceftriaxone. Ama gentamicin. Are you not a culprit of that? Wewe si culprit? Hii pneumonia yangu. Hii asma yangu, kama sijadungwa theophylline, mimi siko sawa. Hii pneumonia yangu, kama sijadungwa hydrocortisone, sitakuwa sawa. So you keep on suppressing the symptoms. Nimegusa watu mahali. So that is number 2. Number 3, this cancer, when it starts to spread, it is very rapid. Cancer of the lung spreads so fast and the prognosis is so poor. It is so poor. And have you had at your lung transplant? Have you had it successful lung transplant? We need to have people who have actually had these transplants. Watuambie. At least we know of kidney and liver transplant. But have you ever heard of lung transplant that was successful? The complications that are coming after that, trust me, we will call it a success maybe 48 hours after the surgery. And the surgeon will take the bragging rights 48 hours after that. And I told you, most people die in the theater. Most people die in the theater. But because you've signed a consent to protect the doctor in the theater, you will be pushed on oxygen into the recovery room, into the ICU. And then the death will be recorded in the ICU. True or false? Wakisikia hivi wataanza kudemonetize channels, ndio? True or false? Our people die in theater, but because they signed a consent to protect the doctor. Hai, daktari mga ataka kuharibu image. Prof, haribu image. Aje, you died in the ICU. But what killed you in the ICU? Are they not complication of the surgery? Yes, he died of complication of the surgery in the ICU. But people die in the theater beds. Wow. Ni watu wangapi wamekufa wakifanyiwa surgery ya appendicitis? How many? How many people have died after the surgery of appendicitis? They didn't die from appendicitis, they died from the surgery, the botched surgery. How many? Anyway, let's continue. So rapid progression and rapid fatality. So it spreads so fast and prognosis is very poor, people die. Somebody saying you can't blame them, they tried. We know. Unfortunately, we know they tried. We know. Hiyo si hatujui bro. We know. Okay? So kazi yetu ni kusaidia, you don't go there. You don't go there for the trial. Our job is to make sure you don't go to hospitals for the trial. Our job is to make sure you change your kitchen so that you don't need to go for the trials. Trials tunaachia footballers, ndio? Number 4, cancer of the lungs, most times it is secondary to another cancer. Specifically, the colon cancer in males, the breast cancer in females. Nowadays, we even have breast cancer in males. Could it be because of the man boobs also? But anyway, all of us have estrogen. So don't blame men who have boobs and you're like, hey man, you have boobs, you might end up getting breast cancer. It's not that serious. All of us have estrogen. You can have an exposure to breast cancer. But breast cancer mostly in women and colon cancer mostly in men. So it spreads now from this all the way to the lung. So by the time you're getting a diagnosis of the lung cancer, there's another cancer. So you will basically die from 2 types of cancers without even knowing. That is what we call metastasis. Metastasis means spreading. And that's why it's very hard to come out of this.